Hello everyone, we're here in Basel for our executive committee meeting, and I'm joined by some of my executive committee colleagues, where for the first time we're going to try a little bit of a different approach to giving you an update on our quarterly performance. We had a strong performance in Q3, both from an operational standpoint, but also from an innovation standpoint. Now I'd like to start with Liz Barrett, our CEO of Novartis Oncology, to give you some perspectives on the milestones we achieved in Novartis Oncology. Liz?
Thanks, Voss. And I tell you, Q3 was an exciting quarter for us, as the whole year has been. But three things really stand out. One is we got the approval in Europe for Kymriah for relapsed refractory DLBCL, as well as for pediatric and young adult ALL, which I think you know patients and physicians have been waiting for this therapy. So we're really excited to be able to bring that to them. The second was our adjuvant approval and adjuvant melanoma for TAF-MEK. Just another milestone in that business. That business continues to exceed our expectations and continues to grow. And that brings another therapy for patients in the adjuvant setting of melanoma. And lastly, we've got some great data on BYL, which is our alpha-specific PI3K inhibitor. And we're really excited about that as well. And you'll see that the data will actually be presented this weekend in the presidential presentation at ESMO. So stay tuned to hear more about that.
Great progress. And when you think about CAR therapy, cell and gene therapy, and building new breakthrough innovation platforms is critical to our strategy here at Novartis. One of the important areas where we made progress as well was in gene therapies, as well as other elements of the pharmaceuticals pipeline. And I wanted to hand it over to Paul Hudson to say a few words about that.
Yeah, we did, Vas, and it's great to mention it. So with AVXS 101 in SMA1, we simultaneously filed in Japan, Europe, and the US, which is a tremendous accomplishment by a great team of people. For those that don't know SMA1, many of those infants won't make it to their second birthdays. We had CHMP positive opinion for Luxturna. And then beyond that, we submitted for secondary progressive MS, a difficult to treat stage of the illness, both in Europe and the US with Siponimod. And then of course, we've launched now our CGRP Aimovig in migraine. Whilst we're pleased from a commercial perspective, we are delighted that what is an over-trivialized disease is getting attention and a huge unmet need as having something brought to it. So, tremendous quarter.
So as you can see, great progress from an innovative medicines perspective on our core portfolio, as well as building cell and gene therapy platforms to drive future growth. We also had an important quarter in Sandoz, where we're building the world's leading biosimilars business with some important milestones. And I'll hand it to Richard Francis to talk a bit about those.
Thanks, Pat. Yes, so quarter three saw some important developments. We've continued to build out on this largest portfolio, maintaining our leadership position. So we got a CHMP opinion in two areas. Firstly, on adalimumab. So we're excited to be bringing that to the market, hopefully in the next quarter, really taking the burden off the healthcare systems from a financial point of view and bringing early access to that therapy. And then the final one is pegfilgrastim, which is another very critical therapy, an important therapy that I know Liz and her team know a lot about. So we're looking forward to bringing that to the market as well.
That's great. And I'm excited to see what's possible now as biosimilars become more and more an important part of the healthcare solution for healthcare systems around the world. So now let's turn to our operational performance, where we've had, I think, a strong quarter where we drove excellent performance. So Harry?
Thanks, Vas. And as you say, innovation is translating into sales performance. Clearly, and Paul mentioned that I have to say something about Entresto and Cosentyx. Entresto more than doubled and sales versus prior year. Also Cosentyx, fantastic quarter there, together with great growth in oncology and biosimilars and Sandoz. So 6% constant currency quarter, the highest quarter growth of this year. And that's translating with our productivity and efficiency efforts to 9% core operating income growth, which is very important for all of us and our investors, because this financial performance gives us then the right to reinvest in fantastic medicines.
Great, thanks, Harry. So as you can see, an outstanding quarter from an innovation standpoint, from an operational performance standpoint, driving our strategy in data and digital, as well as in building future platforms in cell and gene therapy, and most importantly, in delivering on our mission to reimagine medicine for patients all around the world. And I'd like to thank all of our associates around Novartis for their great commitment to our company and our purpose to continue to deliver these medicines that change the lives of people.